about the pandemic strongly. Isn't it amazing? Think about this. Think about the complete and total blind spot. So what happened, I can tell you what happened. What happened in around May, it became known that the virus was going to be amenable to a vaccine. All efforts on treatment were dropped. The National Institutes of Health actually had a multi-drug program. They dropped it after 20 patients, said we can't find the patients. The most disingenuous announcement of all time. And then Warp Speed went full tilt for vaccine development. And there was a silencing of any information on treatment. Any. Silencing. Scrubbed from Twitter, YouTube. Can't get papers published on this. We can't even get information out in our own medical literature on this. There's been a complete scrubbing. So this program has been one of try to reduce the spread of the virus and wait for a vaccine. And when we vaccinate, all efforts have to be on vaccination. And probably if I had 4 hours of vaccination on here. Think about it as we sit here today, the calculations in Texas on herd immunity. The calculations are we're at 80% herd immunity right now with no vaccine effect. 80%. And more people are developing COVID today. They're going to become immune. People who develop COVID have complete and durable immunity. And a very important principle, complete and durable. You can't beat natural immunity. You can't vaccinate on top of it and make it better. There's no scientific, clinical, or safety rationale for ever vaccinating a COVID recovered patient. There's no rationale for ever testing a COVID recovered patient. My wife and I are COVID recovered. Why do we go through the testing outside? There's absolutely no rationale. I'd encourage this committee to actually look at what's being done and ask, is there any rationale? Is there any rationale for anything? Listen, there's plenty of COVID recovered patients. Let them forego the vaccine and let people who are clamoring for it get it. But at 80% herd immunity, in the vaccine trials, fewer than 1% in the vaccine and the placebo actually get COVID, fewer than 1%. The vaccine's going to have a 1% public health impact. That's what the data says. It's not going to save us. We're already 80% herd immune. If we're strategically targeted, we can actually close out the pandemic very well with the vaccine, but strategically targeted. People under 50 who fundamentally have no health risks, there's no scientific rationale for them to ever become vaccinated. There's no scientific rationale. One of the mistakes I heard today as a rationale for vaccination is asymptomatic spread, and I want you to be very clear about this. My opinion is there is a low degree, if any, of asymptomatic spread. Sick person gives it to sick person. The Chinese have published a study, British Medical Journal, 11 million people. They're trying to find asymptomatic spread. You can't find it. And that's been, one of important pieces